Toddlerhood, Chapter 4. Let's see if I can get this thing going. There we go. Children grow faster during the first 3 years, especially during the first few months, than they ever will again. This rapid growth rate tapers off during the second and third years. By 5 months, the average baby boy has doubled his birth weight, and he will triple it by 1 year. By his second birthday, a boy will only add 5 more pounds to his weight. This is my grandson at age 2. This is my grandson at age 5. That's my daughter. She seems pretty happy. A boy's height will typically increase by 10 inches in the first year to 30 inches. They will gain 5 inches in height the second year to about 3 feet tall. A baby begins teething at 3 to 4 months, but they typically don't emerge until the 5th to 9th month. At 1, they will have from 6 to 8 teeth. By 2.5, they will have a mouthful of 20. And this is my grandson at about 2 years old. He's about 3 feet tall, and that's his grandpa right there. This is the first time he ever saw snow. It was in Denver. My daughter was at a volleyball tournament, and he came with her. And so we came down from Montana. I think we were in Montana. No, we were in Iowa at that time. I was teaching at Ashford University. And there he is again at about a year and a half, carrying around his uncle's. You've already seen this picture. This is when he was carrying around his uncle's empty Coke can. There's the Coke right there. He doesn't have any in there. In the womb and after they are born, children develop from head to tail. That's cephalocaudally. Cephalo meaning head, caudal meaning tail. And from the inside out, proximo-distal. Distally, proximo means inside. Distally means outside. The head and the brain are the largest thing about a developing fetus and a newborn. At 2 months gestation, it takes up 1/2 of the body length. At birth, it takes up 1/4 of the body length. As adults, our heads are about 1/8 of our body length. And I'm going to show you an example of that right now in both a male and a female. There's a female. This is her 2 months gestation. As you can see, the head is about 1/2 of its body length. And here is the young lady at birth. Her head represents about 1/4 of her body length. And here she is as an adult. At age 25, it's about 1/8 of her body length. And here's a young man. At 2 months gestation, it's about 1/2. At birth, it's about 1/4. And then at age 25, it's about 1/8. Genes interact with the environment. For example, nutrition and living conditions impact general health and well-being. Well-fed, well-cared-for children grow taller and heavier than less well-nourished and nurtured children. And this is one of the reasons why you should feed your kids as well as you possibly can, and then maybe they'll be tall enough to play basketball. Ha ha! Just joking. They can do anything they want. Better medical care, immunization, and antibiotics have led to better health. Bottle feeding babies did not become possible until the 17th century in Europe, and there was a reason for that. Water, they didn't know how to sterilize water, and they used because their population was growing so rapidly. They didn't have anything to do with their waste. They had no way of getting rid of their waste, so they used their rivers as sewers. The only fresh water you could get would be on a mountain, from a mountain stream where there were no humans above you, or from a glacier. And that's the only place you could get water. Before that time, if a mother didn't want to breastfeed her own baby due to inconvenience or sagging breasts, she would find another woman and have her breastfeed for her. This woman was known as a wet nurse. I'm reading a book right now about the South at the turn of the 20th century, and this one woman, she had two children, and her first child she wasn't real crazy about because her mother liked her, and she didn't like her mother. So she decided after a couple of weeks that she would find an African American woman to breastfeed, a wet nurse, an African American wet nurse to take care of the baby. And then when her second child was born, her mother wasn't that involved with her since she was involved with the first baby. And but she didn't breastfeed that child either. She decided it would make her look or be too saggy or whatever. Anyway, she had the same woman breastfeeding uh, both of her children. In the 19th century, an increase in infant deaths was blamed on wet nurses and bottle feeding. In the 1920s, bottle feeding once again became popular, and it didn't go out of vogue until the 1970s. I was born in 1949, along with, not all my brothers and sisters were born in 1949. We were all born between 1944 and 1954, within 10 years of each other. There were six of us, and we were all bottle fed. This is back in, well, between 1944 and 1954. When my daughter was born, um, no one even suggested that my wife should breastfeed. So she was bottle fed. But when my son was born, a couple of years later, um, we we agreed that how things were going to go. Strangely, she was still breastfeeding when she decided she didn't want to play mommy anymore. As weird as that may sound to some people. Anyway, yeah, we had to wean him really fast. I had to wean him really fast. Nourishment, breast milk is almost always the best food for newborns and is recommended for at least the first 12 months. She left when he was 9 months old. Parents can avoid obesity and cardiac problems in themselves and their children by adopting a more active lifestyle for the entire family and to breastfeed, of course, their babies. Breastfed babies have fewer gastrointestinal infections. Recent research has refuted previous research that breastfeeding reduced the risk of allergies. Breastfeeding for 3 months reduces the amount of wheezing in babies. There is no proof that breastfeeding reduces asthma later in life. Breastfed babies are less likely to develop otitis media, and there's a reason for that. Breastfed babies are held in a certain position, but when they're bottle fed, a lot of times the baby will go to sleep with the milk bottle in their mouth, and the milk will drip out of their mouths, down their cheek, and into their ears, and this can cause a really serious problem. It's really difficult to get that sour milk out of somebody's ear, too. Uh, Atopic dermatitis is a chronic inflammation of the skin. Breastfed babies are less likely to develop atopic dermatitis. And a lot of the reason for that is because of just what I was talking about. Baby falls asleep with the milk bottle in their mouths, and it drips down on their cheek and on their ear, and that's where the atopic dermatitis comes from. Chapped. It's more like chapped skin. It is chapped skin, actually. So that's what happens to them in the wintertime. They get chapped cheeks. Breastfeeding protects an individual from becoming obese throughout the individual's life. Breastfed babies are less likely to develop type 1 diabetes. Breastfed babies are less likely to develop type 2 diabetes as adults. Breastfed infants are less likely to die from SIDS, sudden infant death syndrome. Women who breastfeed are less likely to develop breast cancer. Women who breastfeed are less likely to develop ovarian cancer. Women who breastfeed are less likely to develop type 2 diabetes than women who don't breastfeed. Women shouldn't breastfeed when they have an active infection that may be transmitted in breast milk. This includes HIV. A woman should not breastfeed if she has an active case of tuberculosis. This is caused by the bacteria Mycobacterium tuberculi. And that's what it looks like on an X-ray. This is tuberculosis. That's tuberculosis, and that's it right there. That's the person's heart. A woman who is taking a drug that may be transferred to the infant in her breast milk should not breastfeed. This lady that's called chasing the dragon. That's opium on this aluminum foil, and she's lighting it and turning it into an aerosol and sucking it up through this straw. She should not breastfeed. Taking hormonal birth control pills does not get into woman's breast milk and therefore does not affect the baby, so she can take birth control pills. Selective serotonin reuptake inhibitors are expressed in the woman's breast milk and can cause lethargy, poor feeding, and fever in an infant that is exposed. Of the SSRIs, Prozac seems to have the most negative effects, and Zoloft has the least. Breastfeeding women who find themselves needing pain control can use the following medications safely: acetaminophen or Tylenol, ibuprofen or Advil, oral codeine or hydroxycodone. Morphine and other methods of delivering codeine are contraindicated, meaning you shouldn't use morphine or other methods. The following drugs will cross into the breast milk of the mother and cause varying degrees of problems with the breastfeeding infant: marijuana, cocaine, heroin, phencyclidine or PCP, and amphetamines. These are the drugs you have to stay away from. Alcohol readily passes into breast milk. Infants who ingest milk contaminated with alcohol will drink less milk and maintain a disrupted sleep pattern where they sleep for reduced amounts of time. Heavy drinking by a breastfeeding woman may cause a drunken effect from her infant. Loss of pain sensitivity, deep sleep, inability to suck, and deep respiration. Women who smoke will have nicotine in their breast milk. In the past, it has been reported that nicotine in breast milk caused infants to have more respiratory ailments. However, new studies show that while it isn't suggested that women smoke if they are breastfeeding, there is no proof that there are any negative consequences. Nicotine levels peak at 30 to 60 minutes and take 3 hours to clear from the woman's breast milk. The world has changed considerably since your grandparents or even your parents were children. The leading cause of death until the 1970s was still some childhood illnesses. Now diseases that used to devastate whole areas of the globe have been all but eradicated. Polio, measles, whooping cough, even chickenpox are no longer the scourge of youth. One reason some parents hesitate to immunize their children is fear that vaccines, especially pertussis vaccine, may cause brain damage. Failure to receive vaccinations appear to be more deadly. 18% of the deaths in the developing world are due to preventable diseases. Vaccination has been so successful that smallpox has been eradicated worldwide, despite the fact that I've been vaccinated against smallpox 4 times. Once when I was 5 years old, once when I started college in 1967, and twice while I was in the military. I got out of the military in 1983. My daughter was vaccinated against smallpox. She was born in 1969, but my son, when he was born in 1972, was not inoculated against smallpox. Immunization for better health. It's really important to get immunized. There are people around the United States that don't believe in immunization, and so they're not immunizing their children. Of course, sometimes, and what they have to do is they can't, in most states, they can't go to public schools, or they're really not supposed to go to schools at all. supposed to be around other children. There was just recently an outbreak of measles in central Ohio that killed a number of children. Um, they and it was because of this idea that you don't have to immunize your children. Um, and it's a tragedy. It just doesn't make any sense. Since it's there, why not use it? Anyway, this is the immunization schedule that most the doctors follow. At 2 months, when the baby's 2 months old, the baby will get diphtheria, pertussis, tetanus, polio, influenza, and pneumococcal. Now, this comes in 2 shots, I believe, and the polio is an oral polio. At 4 months, they get another 2 shots, and the oral polio. Diphtheria, pertussis, tetanus, polio, influenza, pneumococcal, and hepatitis B. Now, the reality is these are all childhood illnesses, um, except hepatitis B. Um, and this is what they're trying to prevent. They're trying to prevent kids from getting these childhood illnesses. And we've had outbreaks of these. There was an outbreak of pertussis in Iowa when I first arrived here in 2011. I didn't have any children, of course. My grandson was down in Florida. No, he wasn't born yet. He was born in 2012. Anyway, and I got here in 2011. Anyway, there was an outbreak of pertussis, and it killed a number of kids, and it was mainly the people that didn't get their children immunized. Just doesn't make any sense. At 6 months, diphtheria, pertussis, tetanus, influenza, and pneumococcal. That's 1 shot, I believe. At 1 year, influenza and pneumococcal. That's 1 shot, if I'm not mistaken. At 15 months, measles, mumps, rubella, influenza, and varicella. Varicella zoster causes chickenpox. It also causes herpes, strangely enough, but that's not what they're immunizing the baby against. They're immunizing them against chickenpox. At 18 months, and I think that's 1 shot, if I'm not mistaken. 18 months, hepatitis B, polio, diphtheria, pertussis, and tetanus. That's 1 shot plus the oral polio vaccine. At sometime between the 4th and 6th years, they will get a diphtheria, pertussis, tetanus, polio, measles, mumps, and rubella. And I believe that's 2 shots. They may have put things together differently from when I was working in medicine. 11 to 12 years, measles, mumps, and rubella. That's 1 shot. 11 to 16 years, diphtheria and tetanus. And that is 1 shot as well. At birth, the brain weighs about 25% of its eventual adult weight of 3.5 pounds. By age 3, the brain will be 90% of its total size. By age 6, it is almost at its adult size. The brain's maturation takes much longer than was previously thought. Brain growth spurts coincide with changes in cognitive behavior, the learning of language, for example, environmental stimulation. Both of these are very important. Specialization of hemispheres is called lateralization. The left portion of the brain, left hemisphere of the brain, is where language is produced and interpreted, and the right side is for visual and spatial information and interpretation. The brain represents 70% of the weight of the nervous system. The occipital lobe, which is in the back, that's right here, is for visual information. It's directly in line with the eyes. The temporal lobe is for hearing and language, and it's on the side, right around your ears. The parietal lobe is for touch and spatial information. It's right on top of your head. And the frontal lobe is for higher level thinking, such as speech and reason. And this is one of the reasons why, if we think you've had a concussion, we will hold up a number of fingers and ask you, how many fingers am I holding up? Is there damage to your eyesight? Is there damage to your temporal lobe? Can you understand what I am saying? Um, what else do we do? Oh, we may ask you a question like, well, it takes a little bit of thinking, possibly, to count the number of fingers that you're holding up. We also may ask you who the President of the United States is, what day is it, do you know where you are, these kinds of questions. And that's part of the concussion protocol, so that we can tell which part of your brain has been damaged. Molding the brain and the role of experience, smiling, babbling, crawling, walking, and talking are possible due to rapid development of the brain, particularly the cerebral cortex. Plasticity equals modifiability of the brain. We call it plasticity because it is moldable, it is plastic. Throughout early life, the brain is creating more and more complex neuronal pathways, hopefully with stimulation. And this is one of the reasons why you read to your children and you let them play outside. They need that stimulation, they need that environmental stimulation for their brains to grow properly. Even before birth, the brain is integrating neuronal coordination of muscle groups, a process known as integration. At the same time, select neurons are being developed to have specialized structure and function, a process known as differentiation. When neuronal cell functions are no longer needed or no longer used, cell death occurs and the body prunes the excess brain cells. If it's not needed, it gets rid of it. But it utilizes everything. It's not like it breaks it down and you urinate it out. That's not the way it works. It breaks it down and then it reutilizes it. All that protein, it will reutilize all that protein that it uses when it prunes that portion of your brain that you don't need. A good example of this would be the language learning area of your brain. If a child learns a language before age 12, normally they learn it very rapidly and they learn it very completely. After age 12, it's much more difficult to learn a language. And here I am, I'm 73 years old, and I'm thinking of taking a class in French. And the reason I want to take French is because it's such an attractive language for one thing, but I've always wanted to read in French. Early experience can have lasting effects on emotional development and the capacity of the central nervous system to learn and store information. Sometimes corrective experience can make up for past deprivation. And of course, this is what we hope can happen. If you're missing something, maybe you can get it back. Myelin, a fatty insulating substance, begins about halfway through gestation in some parts of the brain and continues into adulthood in others. This accounts for improving abilities at various times during adulthood. Milestones of motor development. Babies first learn simple skills and then combine them into increasingly complex systems of action. Humans begin to walk later than other species, possibly because babies' heavy heads and the short legs make balance more difficult. One test that has been developed to chart motor development is the Denver Developmental Screening Test that charts a child's progress and compares it to other children of a similar age and gender. I am not a tall person. I'm only 5'6". My wife that had my children, she was only 5'1". My daughter is less than 5 feet tall, but my son is about 5'8", I guess. He's about 5'8". We fed him pretty good. We fed her pretty good. It's not she. My mother's only 4'8". Was only 4'8". So 5 feet's pretty good. She would be 4 inches shorter, and that wouldn't be very good. Anyway, yeah, we fed them both fairly well. What's my point? Oh, when we took them in, In the beginning, of course, they were keeping up with everybody. They were nice big babies. My daughter was about, what was my daughter? My daughter was 8'8", and my son was 8'4". 8 pounds 4 ounces, 8 pounds 8 ounces. They were both 22 inches long when they were born, and they kept up with it. The interesting thing is, my son has size 13 feet. My feet are size 12 and a half. As curious as that is, my daughter's feet are only size 6. But what's my point? My point is that while they were growing up, they kept losing. At first they were at 100%, and they're at 89 percentile, and then eventually, especially my daughter, who's not very tall, she's only 5 feet tall. She's actually 4'11". She started slipping farther and farther behind, but she's not a big person, just like my mother's not a very big person. According to Thalen, normal babies develop the same skills in the same order because they are built approximately the same way and have similar physical challenges and needs. Not until babies can get around by themselves do they learn from experience or from a caregiver's warnings that a steep drop-off can be dangerous. And this is a baby crawling out. That's a plexiglass. It looks to her with her eyesight that she can't crawl out there, but it has plexiglass on it. It's not like they're going to let the baby fall in. But this is a kid. This is a goat, and of course the goat is too smart to walk out there. If there are chances to explore more surroundings, motor development is more likely to be normal. Some cultures actively encourage early development of motor skills, and it all depends on where you are and where you grow up and how much environmental stimulation you have. Training motor skills experimentally, Giselle concluded that children perform certain activities when they are ready, and training gives no advantage. Findings do not indicate whether changes in the brain or in muscle strength or both are involved in motor development, but they do suggest the interaction of biology and environment. And this is my grandson. You can see he loves strawberries, but he was hitting golf balls, and at an early age, he could hit golf balls fairly well. He still plays golf. I don't know if he's that good or not, but this is him when he first started playing soccer. He still plays soccer. He actually has a game tomorrow night at 8:40. So, and a tournament this weekend. He's pretty good. Touch seems to be the first sense to develop. Pain experienced during the neonatal period may sensitize an infant to later pain, perhaps by affecting the neural pathways that process painful stimuli. A preference for pleasant odors seems to be learned in utero and during the first few days after birth. Preference for the fragrance of the mother's breast may be a survival mechanism. Newborn's rejection of bitter tastes is probably another survival mechanism, since many bitter substances are toxic. And this is a baby eating a lemon. Doesn't like it. And next time you slice a lemon, you can take a bite if you like and see if you don't make exactly the same face. Hearing is functional before birth. Auditory discrimination develops rapidly after birth. Hearing is a key language development, so hearing impairments should be identified as early as possible. We had a neighbor when we were living in Germany. The baby he had problems with his ears. He didn't hear very well. He actually had fluid in his ears, and for some reason nobody detected it. And he was 3 or 4 years old, and he still could barely talk. He talked as if he had a stuffed up nose, but he didn't have a stuffed up nose. And then they discovered he had fluid in his ears. So what he was doing, He was repeating the sounds that he heard, and it was sounds that came through water. So it made the sounds that he was making were very similar to that. So it sounded like he could bear, and he didn't hear things completely. There were some sounds he didn't hear at all, but they put tubes in his ears and it drained it, and he started developing language very rapidly after that. Vision is the least developed sense at birth. Vision becomes more acute during the first year, reaching the 20/20 level by about the 6th month. Binocular vision is where the individual uses both eyes to focus. This leads to the perception of depth and distance developing at 4 or 5 months. And this is my grandson when he was first born. And he's looking deeply into his mother's eyes. Doesn't do that anymore. They seem to be fighting a lot lately. And he's 10 years old right now. He's in the 5th grade. In recent decades, survival rates have improved in all regions of the world, but in the United States, there continues to be a disparity between different racial and ethnic groups. African Americans, American Indians, and Hawaiian babies have twice the infant mortality as other groups in the United States. Birth defects, congenital abnormalities, were the leading cause of infant deaths in the United States in 1998. Infant mortality for white Americans is around 6 per 1,000, while it is over twice as high among African Americans. And this is African Americans 13.31, white non-Hispanic 5.63. As you can see, American Indians 9.22. Hawaiian Pacific Islanders 4.78. Disparities in healthcare are considered the reasons for the difference in the larger number of teenage women giving birth to low birth weight babies. And there are some more statistics that show about the same thing, except the native Hawaiian or Pacific Islanders much higher. There's American Indians 8.2, and Asians have the lowest, non-Hispanic whites, and Hispanics are just barely above non-Hispanic whites. What is that? 2018 statistics, and that was 2007. So things have improved since then. 8.2, that was 9.2. And in 2018, it was 8.2 for American Indian or Alaska Native. Low birth weight babies are 5 to 10 times more likely to die from SIDS as normal birth weight babies. When an infant dies in a family from SIDS, later born children in that family have a 2 to 4 times greater probability of dying from SIDS. Infants who hold their breaths for 10 seconds or longer have sleep apnea. 6% of infants with sleep apnea die from SIDS. African American and Alaska Native children, Tlingit and Aleut, are 4 to 6 times more likely to die from SIDS. SIDS occurs more frequently in infants from lower socioeconomic circumstances. When there is smoke in a baby's house, they are more likely to die from SIDS. Infants who are put to bed with a pacifier are less likely to die of SIDS. When a baby is put to bed with a fan in the room, they are 70% less likely to die of SIDS. After the neonatal period, death due to injuries are the third leading cause of death after SIDS and birth defects. Just under 1/4 of the injuries are intentional or homicide. The leading cause of death by injury is homicide. Other leading causes of death include suffocation, motor vehicle accidents, or choking on food or other objects. Just recently, the opioid deaths, opioid overdoses have overtaken accidental deaths in the United States. This isn't for infants, of course. It's just a statistic that has recently come out. Opioid deaths, real serious stuff. And that is the end of the chapter. So next week we'll tackle chapter 5. See you next week.